Good evening, everybody. My name is Meredith Sweeney. I am an occupational therapist who's also a certified driver rehabilitation specialist at Ohio State University Wexner Medical Center. I have been an occupational therapist for 26 years now, just a little bit over, and I have worked in the field of driver rehabilitation for all of those 26 years. Been very fortunate in that regard. I started working at Ohio State back in 2014, and we work out of the Assistive Technology Center of Martha Morehouse. And we also have a satellite where we also provide some driver rehabilitation services. For tonight's presentation, the main objectives include just introducing the OSU Assistive Technology Driver Rehabilitation Team, describe the services that we offer, describe the equipment available, offer suggestions for home practice, and what's the referral process to participate in our programming. The talk itself is going to take approximately 20 minutes. But then we'll open it up for all Q&A. I'm happy to answer any questions you may have. So the Occupational Therapy Driver Rehabilitation Program at Ohio State has a multitude of staff members. Teresa Berner is an occupational therapist who is the manager of the Assistive Technology site at Martha Morehouse. Michelle Fisher, who is pictured in the lower left corner, is the team lead that works out of Martha Morehouse. Elizabeth, or Liz Gowan, is our rehab engineer who assists primarily with our high-tech van. Mary Miller is the third person noted there in the pictures. She is also an occupational therapist that is a certified driver rehabilitation specialist. Myself, I used to work out of the Assistive Technology Center from 2014 to 2020. And then I took a position within the medical center as the manager of the Hilliard outpatient site. That one will be moving to the new Dublin building off of 33 in Dublin. And we'll be transitioning services to there as well. Susan Wolf, who is the far right picture on the bottom, is an occupational therapist who is a certified driver rehabilitation specialist. And then our newest hire is Christine Perko. She is an occupational therapist that is working towards her certification, and she primarily at this point does our novice or what we call no permit evaluations, meaning that the patient coming in does not have a current valid driver's license or a valid driver's permit at this time. I had mentioned the Martha Morehouse Assistive Technology Center. The address is listed there, as well as the phone number. And then the Hilliard Outpatient Rehabilitation Site, the address and phone number are listed there. And then at the bottom is my email address. Maybe during the Q&A, I'll come back to this slide and just leave it up. If anybody wants to take down any of that information, we could leave it up for a while during the Q&A. So what are the objectives of this program? The way I view it, they're threefold. We assist clients or patients who are novice drivers, somebody who's never driven before in their life, but has a medical issue and they want to learn to drive. So for that reason, we are licensed by the state of Ohio as a driving school. We assist clients or patients to meet their goal to resume driving after a medical issue. And then finally, we assist patients, clients with progressive medical conditions to determine when is the appropriate time to stop driving and develop an individualized transportation plan. A common example of that is somebody who has been diagnosed with Alzheimer's. We know there will come a time sadly, because there is no cure at this point for that condition, and it will continue to worsen, and we help patients and their families determine when is the best time to stop driving before an accident happens or before they get lost. I'm willing to bet that most that are on this webinar tonight fall maybe in the first two categories, possibly a novice driver, somebody who's never driven before, who has sustained a head injury, or somebody who was driving previous, had the medical issue, and now would like to resume driving. So when you participate with the driver rehabilitation program, the first part of it is an occupational therapy evaluation that takes place in a clinic. We start out with an interview, just getting to know you. What are your goals for driving? When was the last time that you drove? Once we have the big picture of your current situation, then we typically look at 4 areas. We do a vision screen, similar to what gets done at the Bureau of Motor Vehicles whenever you go to renew your license and you have to press your forehead against the bar and read off the numbers or letters in the machine. We have pictured here on the screen kind of our version of that. And let's say if the one at the BMV is maybe the kind of maybe the Ford version, what we have at the Assistive Technology Center is more maybe of the Cadillac version of it. It does a little bit more than what gets done at the BMV. We also then do a visual perception screen, which tells us how fast and how accurate does your brain interpret what your eyes are seeing. Very important for driving, since the vast majority of the time we are visually taking in the information and then giving a response to it. On occasion, we may hear a horn or hear a siren and we're responding to that sensory input or auditory input, but the vast majority of the time as we're driving, we're responding to visual input. We do a physical assessment that includes reaction time testing of the foot going from the gas pedal to the brake pedal. How fast can that happen? And then a cognitive screen or thinking skills as they relate to driving. Within the scope of that same session, assuming that the patient has a valid driver's license or a permit, then we also complete an on-road portion of the evaluation. So the evaluation itself lasts approximately 2 hours, the first half being in clinic, the second half being in a vehicle. It's important for you to know that the on-road portion must be completed in the hospital-owned vehicle because it's set up with passenger side controls similar to what you would see at a driving school. The insurance for the program is covered under those vehicles. Once we complete the clinical evaluation and the on-road evaluation, we meet back in the room with the patient and any support system that they want to have with them during the evaluation, and we discuss the findings. We integrate what we saw in the clinic with what we saw out on the road, and then we make recommendations. And those recommendations can vary greatly patient to patient. Some of the common ones are listed here. We may recommend training using compensatory strategies or vehicle adaptations or modifications to the vehicle. We may recommend safety procedure training. If we recommend vehicle adaptations and we do the training with them, then we would always follow that with a prescription of the vehicle modifications, assist you with the Ohio Bureau of Motor Vehicles requirements in the things that are required by law to be able to drive with vehicle adaptations. And we help connect you or collaborate with mobility equipment dealers in Ohio who are the ones who install the equipment in your vehicle once you're licensed properly with the modifications. We may also present resources and options for continued mobility if we're recommending driving retirement or a transition of some sort out of driving. We present education for brand new drivers and their parents or caregivers to address some home programming, and some of those I'll be sharing with you tonight. Let's talk a little bit or show pictures of some of the equipment that we do have available at Ohio State. We do have 2 lowered floor minivans that have the conversion of a side entry ramp. One of our ramps is a folding style ramp. The other van has an in-floor ramp, so we're able to share with you what the differences are in the types of ramp modifications that can go into a van. You may notice that I specifically mentioned side entry ramps. There are vans available that have rear entry ramps, but it's important to know that those are meant for transport options only. A person in a wheelchair would not be able to access the driving position from a rear entry ramp. All of our vans are side entry ramps for that reason. If the person in the wheelchair wishes to drive, the side entry ramp is the only option that would work for them. One of our vans is equipped with what we call high-tech equipment. And I guess the easiest way to describe high-tech equipment is it allows an individual to drive a vehicle with very little body movement. We would always want to provide equipment that changes the vehicle to the least necessary, meaning we want you driving in the traditional format as best as we can get there. But for people with severely limited mobility, high-tech equipment may be a good option for them. It requires only the use of fine motor or pinch, or depending on the type of equipment, we can put in shoulder movement. So we can secure the hands in tri-pins and then operate the vehicle through shoulder movement. But we would never use this for somebody who may benefit from moderate tech equipment. We want to use the least restrictive amount of equipment possible. So we also have what we call a mod tech van, our second van, that has in it voice activated secondary controls. So you would push a button that would then start a cue of a voice coming on in the car that would say right turn signal, left turn signal, horn, wipers, and you would hit the button again at the time that the secondary control you are wanting to place on is stated. So it's a voice activated secondary control system. We also have reduced effort steering. So it would be utilizing the steering wheel that the manufacturer installed in the vehicle, but we changed some of the components inside the steering that makes it require a lot less force to turn the steering wheel. And it also has in it what's called a B&D power transfer seat base. So the driver's seat itself can rotate utilizing this control in her hand or utilizing the toggle switches that are on the side of the chair. And it rotates the car around towards a scooter or a wheelchair, allows for a transfer, and then repositions the driver back up to the steering controls. Driving from the manufactured installed chair is always the safest option. If we need this extra mobility, the use of this base, the B&D power transfer seat base, is an excellent option. Still keeps the use of the seat belt as effective as it does without the seat base. But in some cases, remaining in the wheelchair may be the best option for that particular patient. And in that case, then this B&D power transfer seat base, it can be removed completely from the van, rolled out of the ramp, and then allows for access for wheelchair tie downs that are at the steering controls. Our third category of equipment is called low-tech equipment. Here on this picture, you notice there's an extra handle right here on the left side of the steering wheel. The left hand would operate this hand control to operate the acceleration and the braking of the vehicle. And then you'll notice that there's a knob over here. So if the left hand is busy with the gas and brake, then we add a knob to the steering wheel so the right hand can do all of the steering, even at sharp angles. This knob here, this one is a very basic one, but there are many, many variations to the type of steering applications we can apply. Much more than what I have here on the screen, but here are just a few options. This is a tri-pin device. So for somebody with a decreased grip, we can place their wrist here between these two pins, and their fingers just naturally then fit right over this upper bar, the tri-pin device. And that allows them to steer primarily with shoulder movement and not have to have such a strong grip. This other type of knob up here, you're going to notice that there are arrows that would point to buttons that exist on this knob. One button would do the horn. This one would do the flash or dimmer switch, left turn signal, right turn signal, windshield wipers, and then washing your windshield. This type of knob then would allow the left hand to remain constant to the acceleration or brake. And then this knob right here would control all of the secondary controls as well as steer the vehicle. Some other types of low-tech equipment. We'll start up here on the upper right corner. This is a pedal extension that has been removed or out of the vehicle. Gives you an idea of a pedal extension could be anywhere from 1 inch to 10 inches in length. And then this pedal extension right here, when installed, looks like this. The pedal itself then projects out closer to the patient, but while still deploying the manufactured installed brake and accelerator through its contact right here. The device here on the left, this is a left foot accelerator. The mount here at the bottom would get installed at the floor underneath the manufactured and installed pedals. This right here would just be a footrest. Your right foot, when you need this piece of equipment, your right foot or prosthetic is no longer functioning to operate the pedals. So this becomes just a pedal rest. The manufactured installed brake would go in between right here where my arrow is right now, in between the two pedals that you see here. So your brake would remain the manufactured installed brake, but this lever places the accelerator now on the left side of the brake. To be honest, of all the pieces of equipment that I've shown here tonight, this is, even though it's pretty simple in nature, it's one of the hardest ones to learn if you were a previous driver. You have to really be able to switch in your brain that action of now the left side is the accelerator and I need to move my foot to the right to brake. And for previous drivers, that is a very hard, it takes a lot of training for that to become automatic and to wipe out that old learning that exists, that the accelerator is on the right and you move your foot to the left for the braking. Pedal confusion is pretty common with this piece of equipment and takes a great deal of training to learn how to use. I had mentioned earlier that I want to give you all some suggestions for what you could be doing at home to prepare to become a driver again, or if you're a novice driver, to learn to drive. And there are a great deal of many things that you can do as a front seat active passenger. And what I mean by that is that you're sitting in the front passenger seat, but that you're really thinking and taking in all of the driving processes that the driver is performing. Some of the actions you can consider: giving directions to a familiar destination. So you're telling the driver the turns that are going to be coming up. Identify when the car directly in front of you brakes or signals for a turn. That seeing that action and recognizing it often results then in a physical response of coming off of the accelerator and starting to brake yourself. But this part, doing that as an active front seat passenger, really helps you start thinking like a driver again. Another action you can do in the front seat is quickly and correctly identify and state out loud the meaning of all road signs, traffic lights, and road markings. We often have to process information very fast as we are driving. And as a front seat passenger, if one of the goals that we go for is, can you identify the signs, traffic lights, and road markings as the vehicle's moving at 35, 45 miles per hour? Can you state the sign before passing it? And that tells us that your brain's functioning in a manner that's taking in the information, processing it quick enough that you can then produce the physical response required. Quickly identify all developing hazards: pedestrians starting to step out in the crosswalk, bicyclists in front of you, construction zones in front of you, garbage truck collections, and how would you respond in a given situation if you're right behind a garbage truck or a mail delivery vehicle. School bus stopping. If you're behind a school bus, what would you do as the driver? And discuss that with the driver as you sit in the front seat. Additional front seat active passenger tasks that you can do: identify how drivers, pedestrians, bicyclists, how do they communicate with each other? Somebody at a four-way stop waves their hand. What does that mean to you? What would you do if you saw that? What do head nods mean as other drivers are interacting with you? What do horns mean? Why did you hear that horn? What do you think they were honking at? If a vehicle coming towards you flashes its lights, what does that mean? What could you predict is going to happen as I continue forward? Another option is correctly identify when it's appropriate to break a driving rule. This one sounds odd, but as we drive, we want to follow the laws and rules of the road without a doubt, but there are certain instances when breaking a driving rule makes sense. A common action of you, and there's a double yellow line to your left. Are you going to stay at the bicyclist speed, or are you going to cross over that double yellow line and go around them safely? If you choose to go around them safely, can you monitor what the oncoming traffic is doing and when is the correct time to break that rule and cross over that double yellow line? Another one to consider is the timing of when you would brake as you approach a yellow light. If a light turns yellow and you're still approaching the intersection, then yes, it is very appropriate to brake and stop before you reach the intersection. But as your car is encroaching on the intersection, if the light turns yellow, would you make the choice to continue on because you are committed into the intersection, or would you choose to brake and stop somewhere short of that white line or stop somewhat in the intersection? And those are things you can practice as an active front seat passenger. as you approach those yellow lights, you would say, I would brake or I would go, and have discussions with the driver as to what their actions were and why they chose that. Another suggestion for home is there's an app that's called Drive Focus. It was developed by an occupational therapist who lives out in California and works in the same field that I do. And what it does is it puts you through a series of videos that in which you use your finger to tap on all of the critical pieces of information. So you would need to tap on all the traffic signs, all of the traffic lights, cars in front of you as they brake, pedestrians stepping out in the crosswalk, as you see in the example here. Prior to doing the videos, it has a training section that teaches you what are all of the critical aspects of driving and what are irrelevant pieces of information. You know, as the video crosses and you've got a mailbox in that video, if somebody hits on that mailbox, then it's going to tell you that, oh, it's good that you saw it, but it's not really a critical piece of information for driving. So it teaches you what to look for. And there's a training portion of that before you start the video tours. What I like about this app as well is it's a smart app in that it learns where your level is at now, and then it adjusts the speed of the videos or the type of videos that you do to match your needs, and then it begins to challenge you. And then finally, for the talk tonight is the referral process. If you're interested in participating in the program, a physician's referral starts the whole process. If your doctor's within the OSU system, then it's just an electronic referral within our medical records, our electronic medical records, and it's called ambulation referral to occupational therapy driving eval. Once that referral is sent to us in our system, you'll get a call from Pam, who does our scheduling, to start the process. If your physician is outside of the OSU Medical Center system, then it's still just a referral from any physician. We just need your demographics, your information of how to contact you, most recent physician notes, and it gets faxed to the number that's there on the screen. So I apologize for my technical difficulties. I will go back to the information screen there. What questions do you have?
I'm muted. Meredith, there was the initial question that our student Jay was asking about, how does this work when you're really not in a driving kind of environment? Maybe you're living in an urban area, or you just don't need it, right? Can that be a challenge, or is it because it's not part of your life, it's not a challenge?
Well, my first job in 1996 out of college was in New York, so a very urban area, and I still worked within the scope of driver rehabilitation services. When people, and here's what I found in that setting, is we saw patients with varied goals. Many of the patients lived outside of the city but worked in the city and needed to be able to commute at least to the train station. So their goals were very specific in nature for a route. So we may work with them on those specific routes to meet their transportation needs. In other instances, it wasn't necessarily so much about driving, even though it's called driver rehabilitation, but more about the community mobility. So can you return to using the subway? Can you return to using the bus system? Can you return to using taxis? Now, I will say this was before the time of Uber and Lyft, but that would be appropriate I'm aging myself there, but that would also have been appropriate in that time frame had it existed. Is it something that travel training is, can the type of travel that suits your lifestyle still be accomplished? And if not, what can we do to help get you there?
Okay. Jay, did that answer your question?
Yeah, and just as a quick follow-up, I'm curious as to like how things like I know we talked a lot about like the motor and the decision-making skills of like rehabilitating yourself as a driver. But what about like, do we talk about like how to advocate for yourself? Like say that, you do get in an accident of some kind. Do you know if there's any bias? I would assume there's bias from like if the police officer is on the scene and two people got in like a bumper crash or whatever. And like, do you feel like brain injury survivors are able to advocate for themselves? And, like maybe like they're looked at automatically as being the one who caused the accident, even if, you know what I mean, they didn't. I don't know that I'm phrasing that right, but just like, are those barriers as well?
Yeah, so the state, I didn't include this in the slides because it felt very specific, but I'm happy to answer that question. Let me give a tiny bit of history about how this came about and then what the new law is. So approximately a decade ago, there was a young man with a communication disorder that was driving on the 270 outer belt and was pulled over by police. His communication disorder was autism in his situation. And when police pulled him over, his behavior was such with his medical issues that the police didn't identify that they thought he was impaired through some type of drugs or alcohol. And it resulted in a very negative outcome in which the young person exited the vehicle on 270 and was struck. The result of that whole situation and having the state really look at how to best manage communication disorders is they now have a voluntary registry for communication disorders. And they call it that because there's a variety of things that could fall into that. But essentially, the key component is if you feel you would have challenges engaging with law enforcement in a manner that they would expect to be the norm, then you can voluntarily put yourself on this registry through the Bureau of Motor Vehicles. You can do it online or you can do it at the BMV. When you put yourself on this registry, you can give them as much or as little medical information as you want. But whatever information you provide, when they run your license, that pops up now on their computer screens. So they know as they start to engage you as a driver that they have pulled over, that there is a medical issue involved and they won't naturally assume that drugs or alcohol are involved. That's one thing that Ohio is doing. Part of our programming is we've been engaging with the OSU Police Department to start to have for our clients who we feel may have challenges knowing how, we don't do this with all of our clients, but for our clients who we feel may have challenges in interacting with law enforcement. We've been working with OSU's police department to develop kind of a programming where we can kind of put them through that practice run so that they know they've been through it before in a practice scenario and find some success before actually going out there and independently driving.
So there was a note in here in the chat from Jackie. She said her speech therapist told her, something similar. If they knew that you had a TBI, it would be most likely your fault. So, how do you reflect on, I guess, is that changing? Do you feel like that perception is changing because of all these trainings?
Oh, I do. When this communication law was passed by the state government, in addition to the registry and the Ohio drivers putting themselves on this registry, part of that law was also then the police academy training, and added some additional training for the cadets at the State Highway Patrol for how to, once you see this pop up on your computer, what should your actions be? And they now have more knowledge on medical conditions as part of their schooling.
So
Okay.
can I ask a question?
Please.
Sure.
So is this just Ohio? The state also have a similar the registry for the people who have a special needs?
So yes, it is only in the state of Ohio. It's a state law, and it's only the Ohio Bureau of Motor Vehicles that accept these notifications from the general public that they have a communication disorder. Now, in the way the law was written, they decided to go with the terminology of communication disorder. But if you choose to put yourself on that registry, you can identify whatever special needs you have. It doesn't necessarily have to be I stutter or things that you would think of in a traditional sense of communication. You can put in whatever medical information you would want them to know.
And then one other thing that we have in, that's going through the Brain Injury Association is that there are TBI identification cards as well. And so, that can also help. So Jay had put that question in there. Would it be easier to put a designation on a license? But there are other forms of ID that can serve that purpose. Yeah.
Before this law was enacted and there is now this formal registry, what I used to teach clients was to have in your car a signed physician's note that states your medical issues clearly, not just the medical jargon of your diagnosis, but how they impact you. How do they manifest, so that you could give that to the law enforcement or whoever you're interacting with, to let them know and have it signed by a physician so that they know that it isn't just a made up piece of paper, and have all the contact information there that that the driver would want a law enforcement official to have, whether that be your doctor's number or your emergency contact, things like that. But to engage in that communication in a manner that it keeps things calm. Now that Ohio has that law, we've pulled away a little bit from that, and we now encourage doing the actions that the state has determined is the best route for law enforcement. So right. I'm on the fence about that. It would have the potential to get you out of a sticky situation, but at the same time, it's your functioning nearly like your old normal, like I am now. I feel like it would have the potential to hurt you as well. Yeah, I would say the one thing I do like about this new law and the registry is that it does give you the choice to only put on the information that you would want to have out there, and that it's completely voluntary. It is not mandatory for people with medical issues to go through this. And so it's not a physical printed designation on your license, but what it does is as they run your license, it notifies law enforcement automatically. Yeah. And then I see an optional ID card that you can choose or not choose to give. Definitely seems like a good compromise between the two. Mm-hmm.
All right, folks.